If you have been thinking about taking a GLP-1 agonist medication to lose weight, or you're already on a GLP-1 agonist medication right now for your weight loss journey, this video is important. This is part 3 of the GLP-1 agonist medications are in danger series. Basically, I've outlined what's been going on with the compound medications coming off the FDA shortage list and the manufacturers taking back their right to be the sole provider of the medications. So my name is Dr. G. I am your internal medicine doctor and am also a lifestyle modification coach and a patient education specialist. Once again, in preparation for the GLP-1 medications such as Wegovy, which is Semaglutide, and Zepbound, which is Tirzepatide, becoming more available in the market through the manufacturer and coming off the FDA shortage list, this is going to resolve their supply chain issues. But at the same time, it's going to make a big issue with the fact that, many people who are using the compounded medications won't be able to get those medications. So this is my advice on how to go about planning for that day. You no longer are going to be able to get your medications from compounding pharmacies. First thing you should do is, if you're using right now a compound medication from a compound pharmacy, contact that supplier. Understand where they stand as to where they are with the back and forth between the compounding pharmacies and the compounding pharmacy association, suing the FDA to slow down this coming off of the shortage list and now supplying the medication solely through big box pharmacies or through the supplier themselves. So call them first, see where your supply is and how long you're going to have access to your compound medications. This is whether you're starting or if you're on the medications already for a short or long period of time, so that you know where your supply is. Now, once they tell you where your supply is, and they say, what if they say, we're only planning on selling it for the next couple weeks, you may find it necessary, and if you can afford it, you may find it necessary to get more medications than you would usually order for beyond your normal order time. So if you usually order 2 weeks at a time, or a month at a time, 3 months at a time, you may want to extend that and get more medications just to tide you over until you get to wherever you want to be at the end of your lifestyle modification journey and your weight loss. This is going to be, again, like I said, this is especially important if you are not at or near your weight loss goal. Or you're already on a maintenance dose, or you're just starting the medication and you just started maybe the first week. You don't want any interruption in your care. We talked about interruptions in the second video of this series. Now let's get into the specific tips. The first thing that you need to do, it's going to sound repetitive, but it is absolutely part of the whole journey and what we need to be doing anyway. Get a medical evaluation and make a serious plan as to how you plan on losing this weight and doing the work of losing weight. Get your medical evaluation by your doctor. Get a reassessment of your BMI, your obesity conditions that are related to your BMI, diabetes, sleep apnea, hypertension. Get your doctor or a doctor to evaluate you once again to see where you stand. Then you're going to review your current medications if you're on any medications outside of the GLP-1s, and you're going to get evaluated for any GLP-1 medication contraindications. This is just touching base again, like you're starting all over to make sure that everything is okay. You can start the medications or stay on the medications. Maybe there's something came up and you don't need to be on them anymore. You can't be on them. Be sure to continue to track your calories, your food intake, and your macros, and make sure that you are working towards adapting a balanced diet with a huge emphasis on portion control, right? And then, of course, incorporating your whole grains and vegetables and making sure that you are doing what you can to increase your fullness level as you are not sure how long you're going to be able to keep the GLP-1s in your lifestyle modification journey plan. And of course, as always, we're going to emphasize protein and we're going to limit refined carbohydrates and sugary foods in our nutrition plan. The next thing you do is need to reevaluate and drill down on your exercise and activity levels. Again, I'm going to say it for the 1 gajillionth time, minimum 150 minutes of active exercise, but shoot for 200 per week. And focusing on a mix of aerobic activity and strength training is super, super important to increase that lean muscle mass while you are ramping up your protein in your nutrition. Always starting slowly is important if you're starting out your weight loss or fitness journey. But if you're already on the GLP-1 agonist, while you're trying to figure out how long you're going to have this stuff, keep that intensity up. Intensity, 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 so you can maximize your weight loss overall. And then the last thing, to optimize your weight loss as quickly as possible, or if you're already on it and you're seeing maybe the end of the road is coming with your compound pharmacies, making sure your hydration is on point, making sure your sleep is on point, making sure your fiber intake is on point. I said that in point 3, but make sure that you have all of the little things that you need in order to continue to maximize your weight loss while starting or on these GLP-1 agonists, and if the end is near with your trusted compounded pharmacy. This is a big one, and I'm going to talk about it separately, but it goes along with the rest. In mindset and your expectations, you need to continue to set realistic goals with your weight loss. 1 to 2 pounds a week is what's normally, usually the target, but I've seen and safely much, much more, up to 5 pounds a week, 4 to 5 pounds a week is doable with these GLP-1 agonist medications. That way you can time out how long you need to be on these medications. And trust me, 5 pounds a week, I've seen no adverse effects to any of these patients who are on GLP-1 agonist medications lose 5 pounds a week, and they do just fine. So trust me, if you're doing that, you're gonna be fine if you're doing it the right way. Proteins are high, refined carbohydrates are low, and you're doing resistance training. Because I've seen routinely patients continue to get more weight loss when they develop good habits and are willing to acknowledge the things that they have or haven't done that have caused their current weight to increase. So it's very important to lean into what it is that got you to where you're at right now. If it's life that happened, if it's food that happened, the stressor that happened, or you just got, just new job, what a lot of things that come in the way between your nutrition and your activity level, your exercise. So honing in on that and fixing those are very important. So most of my most successful patients have incorporated some kind of behavioral health or mental health counselor to help them achieve their weight loss goals, especially for some reason when the weight loss goal is more than 40 pounds. Makes sense if it stands to reason if your weight loss goal is bigger, that you have been with these bad habits for a longer period of time and they become more ingrained and you need a little bit more help. Although everyone could use a mental health expert on their weight loss journey. So understanding that weight loss is a gradual thing with GLP-1 is not an immediate fix. It is not a magic bullet. Like we say in the 11 things you should not do on GLP-1 agonists. So making sure that you understand that this is not a turnkey type thing. One of the biggest concepts that you need to understand in order to be more successful quickly with these GLP-1 agonist medications. When I say that, be more successful meaning that you are taking more of the burden of losing the weight and it's less of the medication. And I can't reinforce enough the concept that these medications work best in conjunction with lifestyle changes. So we have no trials. There are absolutely no trials where nutrition and exercise was not taught and actually part of the trial. And they clearly made a difference in the outcomes that came, that in the trials. And that's how they got their FDA approval for weight loss. So it is imperative that you address your barriers and your triggers. What is a barrier? A barrier is something that stops you from doing what you should do. And trigger is something that moves you to do something that you shouldn't. Using this information, it gives you the opportunity to identify your weaknesses and strengths, and you can use that information to form your daily and weekly and even your long-term plans for weight loss success. So understanding that lifestyle modifications are the basis of everything you're going to do. On these medications, the medications are helping, but if you can understand that and dive into that earlier, you can come off these medications and not be as reliant on the actual supply of the medication. And that's what you can do. Now, there's other things that you should do as well, and that's going to help you get a better idea of what you can do for the longer term if you see that you're going to need it for more than the next I would say the next 2 to 3 months, they're going to figure this out between the FDA and the manufacturers. And so what I want to hone in on this part of the video is understanding where you're going to continue to get your prescription and what your treatment plan, your long-term treatment plan is going to be. And that's going to require you to have a relationship with a doctor, or a physician, or someone, or a medical provider who can, write these prescriptions, because as they come away from compound pharmacies, which, some of them you would get online evaluations, and they would do it. They would give you the prescriptions over the internet. But now you're going to probably find that it's going to necessitate some sort of visit, probably with your primary care doctor or obese medicine specialist. So the first thing you need to do is figure out what your insurance coverage is. Your insurance coverage is going to be paramount to know whether or not they cover weight loss medications or obesity medications or not. So calling them and getting a clear idea of what weight loss medications they do cover, if any at all, is going to be very, very important. You may need to change your plan if any of those ones they do cover don't work for you, or it's just not something you want to do, and move to another plan, if you can, that does cover the GLP-1 agonists, which are, the cream of the crop right now for weight loss. The second thing you can do is, if you do have the ability to get the weight loss medications, GLP-1 agonists, through your insurance, then exploring patient assistance programs may be beneficial for you if you have issues with making payments for the copays. They have copay assistance programs through the manufacturer. You would call them and get on one of their assistance programs. If, for example, Tirzepatide, it's between $500 to $600 a month. It's still pretty high, but it is some sort of assistance that they have for the medications for you. Finding a doctor that understands how these medications work, what the best plans are, what good advice for how to mitigate side effects and everything else is important as well. If you had one already, a doctor involved, it's important to find a doctor who's open to using the GLP-1s for weight loss. Not every doctor is going to be as open or understands how real obesity is as a disease. Unfortunately, not every doctor is going to be open to giving you medications like these for weight loss. So finding the right doctor is very important. It's going to be very important for you, because you're going to have to go through a doctor, it looks like, in the foreseeable future. I think, after this compound pharmacy thing goes away, or the compound pharmacy struggle, which is happening between the FDA, the manufacturer, and the compound pharmacies, let's be honest, it's going to happen. There is going to be a day, don't know when, in the next 3, 4, 5 months, where these meds aren't going to be available through the compound pharmacies anymore, and you're going to have to go to a provider to get that through your insurance, most likely, or the provider is going to have to actually write the prescription for you so you can buy cash pay out of pocket through Walgreens or wherever else. So that doctors are going to be, necessary through this process. And if you're going to, have to go to a doctor anyway, get a good plan and get a good idea of, managing the issues with the medications. They might as well, if they're going to be part of the process. So finding someone who is an expert at GLP-1 agonists like myself, or someone who's an obese medicine doctor who is also a GLP-1 agonist, I'm sure I'm a professional and expert, it's going to be paramount for your lifestyle modification process, at least for a time, because in the end, again, lifestyle modifications alone, meaning your nutrition and your exercise, understanding your barriers and triggers, is going to be what you're going to, that's going to be the end all for you. That's where we're going to end up, because what you use to get there is how I expect, my patients to stay there. So the medications help to suppress the appetite, yeah, but really what we've been doing for the last 3, 4, 5 months is identifying how to live with these amount of calories and this amount of exercise to maintain your weight. Along with those changes in lifestyle modifications, your barriers and triggers, your nutrition, and your exercise, I want to re-emphasize the need for you to possibly look into psychological support, therapy sessions, such as cognitive behavioral therapy, or even support groups. We're trying to form a community here on this channel, so that way, we have who are like-minded people and have the same type of goals can be a support group for each other if you don't have one locally where you are. Let's not forget that you're not all by yourself and all done and oh, well, I can't get GLP-1 medication, so nothing is ever going to work for me. I don't want you to feel that way. I want you to understand that there are other medications out there. We can always try them, but with the basis of the lifestyle modifications and maybe one of those other medications that have been on the market before will help in some way and help you to at least lose some weight so that you get some of that positive feedback on your journey. So the emphasis here is to understand that the GLP-1 agonist medications are in danger. Let's not sugarcoat it. They are in danger once they come off of that compound space. Will absolutely decrease the amount of access to, I don't want to say millions of Americans, but for sure at least 1 million Americans will be affected by this. There'll be a lot of folks who will be left without GLP-1 agonists and the benefits of them because of the compounding space and the way our insurance works and pricing. Some of the coverages are not going to cover a weight loss medication. So you're going to end up having to pay out-of-pocket fees that are pretty high, a lot higher than what the compounding pharmacies in the compounding space has been offering over the last 2.5 years. It just emphasizes the need for us to make a plan, understand where our insurance is, understand what our doctors are willing or not willing to do. And the one thing that you absolutely can control for sure is your nutrition, your exercise, understanding your barriers and triggers, and getting psychological support for your behavior if you need it. And I think just about all of us need a little support in that realm. So that's the three-part series. First one, I talked to you about what the problem was. Second to you, I told you how the pharmacies are fighting back for you. And now this third video is basically the things that you need to do to prepare for the inevitable. And that is it for this three-part series of the GLP-1 agonist medications are in danger. Take a look at the description below. I've got a bunch of goodies down there. One of them, of course, you got the lifestyle modification coaching. You can call me directly at the office, 954-932-3269. We can do a televisit and get all of this and other things in order for you. We've got a TDEE calculator. That'll help you on your weight loss journey. We've got some goodies down there with respect to your meal planning with Trifecta. There's a coupon code down below, Dr. GLP-1, which will get you 40% off your first meal order with Trifecta, and they have a great high protein GLP-1 meal plan menu. I'm eating it here in the office, pretty awesome. So lots of goodies down there. Don't skip that. Go down below and take a look at all of the goodies that we got for you. So that is about it. Stay healthy, stay informed, and I will see you soon.